An inquiry into how thousands of Scottish NHS patients became infected by blood products is being published today. Many developed HIV and hepatitis C in the 1970s and 80s after being given infected blood. Matt Gregory is one victim and a trustee of the haemophilia support charity, the Macfarlane Trust.
Some people were not told until many years after their infection when the medical staff knew, which led them to both infect their sexual partners and not be able to adjust their lifestyles to compensate.
In the last hour, we've had a report into contaminated NHS blood products in Scotland in the 70s and 80s. Earlier, the chairman of Haemophilia Scotland, one Bill Wright, who was affected with hepatitis C back in the 80s, told 5 Live the scale of what happened was almost unimaginable.
This disaster is actually bigger than anything since the war. Any transport disaster, any football stadium disaster, any disaster at sea. And I think the difference with this particular disaster is, rather than happen at a single moment in time in a single place, this is a disaster that has stretched over several years, indeed decades, and of course has been spread the length and breadth of Scotland and indeed Britain as a whole.
Let's have a quick chat to James Shaw, and then we'll talk to somebody who was diagnosed with hepatitis back in the 90s. But James Shaw, first of all. So give fill in the background. How have we reached this point, and why has it taken so long to reach this point?
Yeah, well, we have to go back to the 70s and 80s. This was the time when people who had blood disorders and were given blood transfusions were being given contaminated blood, not known at that time to the health service people who were doing that. And that carried on for a considerable period of time until it was realised that they were being given contaminated products. And the significance of this, Peter, is that there has not been an inquiry of this kind for the whole of the UK. It has only happened in Scotland. It was started back in 2008, so it has taken an enormous amount of time because of the complexity of it, the number of witnesses that had to be heard, and the complexity of the medical evidence. But what the inquiry has told us is something about the scale of it in Scotland. So, for example, we are told that more than 3,000 people with blood disorders and people who were given blood transfusions were infected with HIV or hepatitis C. At that point, you start to get an idea of how big this situation is.
I think I can talk to a couple of people now. One is Bruce Norval from Fortrose, who... hi, Bruce. Hello, Bruce, can you hear me?
Yeah, I can hear you.
Yeah, thanks for joining us. You got diagnosed in, 1990, I hear?
I was one of the first people diagnosed with Hep C in the country, yes, in 1990.
Yeah, and after all these years, how has life been as a result of that?
I've not been able to work since I was 30. I'm 50 now. I've lived very much financially hamstrung by the impacts of the disease, and become quite dependent on my wife for care and my long-term needs.
That must make you, angry, to be honest.
I am furious that professionals who supposedly acted paternalistic towards me suddenly turn into professionals with detachment the moment the cost of what they did to me becomes apparent.
You think they kind of washed their hands of you? That's what you feel?
No, it feels like nobody's taking responsibility. I know this case backwards. I was the person who discovered much of the evidence that's now being taken for granted. And I can tell you this inquiry hasn't listened to victims. It has taken evidence from a very specific time frame, which has resulted in what, quite frankly, is nothing short of a whitewash. This inquiry report is stuff and nonsense. It is inaccurate, it is incorrect, and it's failed to understand the true extent of the complaints that we were making over the last 30 years.
So, you damn it before you read it, or do you really know what's in it already, Bruce?
I have read it. I've had it for 7 days. I have read this report from start to finish. It is a completely disjointed, nonsensical document that sometimes doesn't even excuse areas of legal breaches, just states them. quite clearly indicates that the Nuremberg Code was broken, an accusation I've made against the British government for over 20 years, but it excuses it because everybody was doing it. So collective incompetence seems to be part of the defence here.
Yeah. Well, I can tell you're angry. Thank you for talking to us, though, despite your feelings about this whole matter. I think I can also speak to Mark Ward. You got hepatitis C as well, Mark.
Hello, Peter. Well, yes, I got hepatitis C, but I also was given AIDS as a child. I was exposed to new variant CJD, the human form of mad cow's disease. The list goes on and on and on because the treatment was so dirty and filthy, and the places it was being sourced from, anything could have been in that blood.
What do you expect from the report, or do you, like our last guest, really know what's in it, and what do you feel about it?
No, I'm actually one of the people that was kept in the dark. The only thing that I have heard coming from the report is that Lord Penrose didn't uphold or didn't find that non-consensual testing and research, basically us being treated as guinea pigs, is backed up. And I don't know what information he's been looking at, because certainly I can tell you that as a patient, I know that I was treated as nothing more than a lump of meat to be experimented on, and that is right across the board when it comes to people with bleeding disorders. We were used as objects of research.
Yeah. I wonder if I can go back to James. I mean, are you still with us, James? Yeah, James has left, unfortunately. I'm interested to know what... is Bruce still there? Are you, Bruce? Yeah. Yeah, he's gone as well. That's a shame, really, because I wanted to know what the key questions are. Well, I mean, Mark, some people texting want to know, has there been compensation for all this already, and what kind of level of compensation has there been?
No, Peter, there's never been compensation. The British government has been very crafty about this. What they've done is, for compensation to be awarded, you have to have liability and fault found. And as you rightly said, that there's never been a public inquiry in England or the United Kingdom until now. So if you don't look for fault, you can't find fault. And if you haven't found fault, you then don't pay compensation. So what the government did was, in the late 80s, with the haemophiliacs and people given AIDS, they gave £20,000 ex gratia payment because we were all going to be dead within 3 years. So it sounded an awful lot of money, but here we are 31, 32 years on, and no, there has never been compensation paid.
What has the impact been on your life, if you had to summarise it?
To be honest with you, I can only say that it would be like I have lived my whole life trapped in a lift that is out of control. It drops the floor and then you think you're going to die, and then it doesn't, it stops. But it can drop at any minute, and you know that at some point it's going to hurtle to the ground and you will die. So
you're still living with that kind of perpetual fear in your mind. That's how life seems to you.
Yes, because when you've got a doctor, Peter, that says to you, do not go out in crowds because you are a sitting duck to infection, the common cold will kill you. Even to this day, I hate going out in crowds because I don't know what people have got and they may be harmful to me. Yeah.
Well, could any report help, Mark, or is it, the damage done now, isn't it, really?
Well, any report and any amount of money that is awarded compensation can never undo the harm. It can never take away the stigma, the fear, the blood, sweat and tears to get here. It can never bring back those children that were lost, the husbands and the wives. It can never replace any of that. But obviously financial security is one thing we do need. And also we need to make sure that the doctors who caused this, they're not suddenly going to turn into Florence Nightingale. So the care that is now needed to take us victims forward needs to improve.
Right.
And the support of the bereaved needs to also then be improved because they've had nothing either.
Right, Mark, thank you for that. Mark in Peacehaven.